All right, so this is good for, I don't know, call it new graduates or recently graduated, or I don't know, somebody who is still doing this for a long time. But I'm decently good at managing my schedule with time efficiency and what we call productivity. So if you look at your schedule, even after graduating from dental school, the first challenge that I always see from new graduates, and that includes myself, I was also in those shoes at a certain amount of time. Treatment planning. So that's your number one focus. You need to plan treatment and have a roadmap from start to end. A for predictability, B for arranging your schedule, like just knowing exactly what procedure you're starting, when to start, and that all comes from treatment planning. In my school, I went to NYU and we had a treatment planning seminar. I still remember it was 6 o'clock or 6:30 in the morning, and every single person would dread to going to the treatment planning seminar because it's way too early, it's way earlier before clinics, everybody is barely awakened, and you have to attend this whole 1 hour session where all you're doing is just looking at x-rays and planning treatment. I found that to be the most important thing in the dental school versus everything else, is that every person can be taught about doing a filling or crown prep. Everybody has been through the national board, so you know how to prep a tooth, you know how to do SRPs. So not always necessarily it's about the skills. You have the skills, every other person also has the skills, every other person might be able to do a really good crown prep. That's not the point. The point is that did you treatment plan it as good, meaning that does this tooth actually need a crown? If it needs, what type of crown? Did you think about all the steps, how much time you're going to need, how you are going to delegate your assistants to do what part of the process? All of these things really come in treatment planning. Once you treatment plan things, execution is just a small part of the equation. Now every other person, like for example, I can treatment plan it and give it to an associate and say that if you follow these steps exactly, you're going to be efficient, productive, and the patient's going to be happy because things have been treatment planned really well. Meaning that I'm not talking here about how to make your skills better, I'm just telling you to sharpen up your administrative skills in a way that increases efficiency. Second part of the problem is that, okay, once you have the treatment plan, it is challenging, hard, and difficult to what we call get a schedule under control. So working with the front desk is extremely important as a dentist. Like, I'm not the type of dentist who sits in my office. Heck, I don't even have an office in my own office. I'm always working at the front or I'm working with patients, because I work with the front desk because nobody knows my schedule better than myself. I know which patient to schedule when, how much time I'm going to need. Everything has been very, very clear where to add patients in what time of the schedule. If there's any modifications needed, I'm going to immediately move on it. So I'm keeping one eye at the front desk, one eye on my patient, and my third eye behind what's going on in the back with the assistants, and really managing and delegating their duties to maximize my schedule. Let's look at this schedule. I think we have a privacy mode going on right now, but for example, my patient at 9:50 in the morning. Before that, we have a weekly meeting with my financial coordinator. We go over what are the plans for the week, the month, and the following year, especially the first quarter, especially when we are at the end of the year in 25. We need to plan and look ahead what 26 looks like. So we have a quick meeting. I already know that the patient at 9:50 now needs a follow-up from a procedure that we did 2 weeks before. Here's the thing, right? I know that my assistant would be able to see the patient. My assistant know that every follow-up patient needs a picture. Picture meaning an intraoral picture. We use mouthwatch. You can use any brand that you want, but it's a simple thing. Patient comes in, every follow-up patient, first thing we start is taking a picture. So even if I'm in a meeting, patient comes in at 9:15, I'm not done with my meeting until 10. But in those 10 minutes, an assistant is delegated to see the patient, go over how they are feeling, note it in the chart, take a picture, and get it ready. Now, let's talk about schedule efficiency. The immediate instinct of every provider is that as soon as you come out, you look at the picture, you want to go in to see that patient. Here's where I would advise you to think a little bit different. My 10 o'clock patient needs an extraction and a crown prep and a post-op from the 2 implants we did last week. I'm not going to see my other 9:50 patient for the follow-up first. I'm going to hop into my 10 o'clock patient. The other thing is that be very, very punctual with your timing and hold your patients accountable to the timing, meaning that I run a very tight ship here. Timing is everything for me. I'm very OCD when it comes to timing. 10 o'clock patient has to be in the chair at 10 o'clock. My staff is trained that way. Patients know that very well. I don't like when it's 10:02, 10:03, dot on the dot. If I come in and if my 10 o'clock patient is not seated in the chair, I get upset. Anyways, let's move past that. 10 o'clock patient is here. As you know, if you need a crown prep extraction, what's the first thing I need? Anesthesia. So I'm going to go in for my 10 o'clock patient. I'm going to numb the patient up first, have a conversation of what's happening with their procedures through the day to day, how much time I'm going to take, walk them through each step of the procedure planned for, numb the patient up. As you know, You want to wait 15-20 minutes, at least 15 minutes for everything to get nice and numb. Now I use those 15 minutes to go to my other follow-up patient, because while this patient's getting numb, they're getting numb. That's 15 minutes that I have to do something else. Something else means I'm going to do a follow-up with that patient, because this follow-up patient on the side book is what we call needs follow-up, and honestly more about talking. Hey doc, okay, I'm here, everything is healing fine, what the next steps looks like. So what I'm doing is like literally talking and walking them through for about 15 to 20 minutes what their next steps in the procedures look like. I'm taking the 15 minutes that this patient is getting numb, grabbing them and putting the 20 minutes or 15 minutes into this patient. By the time this patient is done, I'm ready to go with my patient who is already nice and numb, needs a crown prep, needs an extraction. Simple thing. I'm going to start with the crown prep first, because the last thing you want is extract the tooth next to it, have a bloody site, and working on a crown prep. It's just not advisable. So be clear in your steps of the procedure. So you're going to start with the crown prep, get the temporary made. I'm not going to glue in the temporary, because again, if 14 is to be prepped, 15 needs extraction, during the process of extracting 15, I'm likely going to knock off the temporary that I just glued in. So again, these are the little things. But if you prep 14, I'm not going to do temp bond cement right away. I'm going to now extract number 15. Then I will come back and glue the temporary crown on number 14. Put gauze or sutures, post-op instructions. By the time my post-op instructions are starting, I know that from 10, I should be done about 11. By now, I know how long my procedures take. So that's why I have timed a 90-minute appointment. 10 o'clock check-in, 20 minutes numbing, about 40 to 50 minutes of my time, prep, extraction. By 11, I know that I'm pretty much done. But I do know that my assistant needs to give instructions, have the patient wait for 15-20 minutes, make sure they are doing all right. Now I'm going to start my procedures about checking the next patient, which is basically implant scan. So my second assistant has already seated this patient, which means that they are going to again take an intraoral picture, making sure that the patient is ready to go. My scanner is going to be ready. The pre-op scan is done. So now my job comes in to put the scan body in. Again, 10 minutes of a job. So now you can imagine that by the time it's 11:30, all three first patients of my day are cleared exactly on time. So it's not really about condensing procedures, it's just knowing where you need to be at what time. That's called schedule management efficiency. So it's not really about condensing procedures, it's just knowing where you need to be at what time. That's called schedule management efficiency. You hear this term a lot, especially with once you are out of school, is that productive procedures versus non-productive procedures. I don't really look so much into it, productive versus non-productive, meaning that there are a lot of offices which really say column 1 as productive, column 2 as non-productive. There are too many school of thoughts on it. My thought process is usually I like my first column as a procedure column, second column as scans, follow-ups. Crown insert I don't call a second column, I call it first column, because crown procedures and insert really need a good amount of time, of my own time being in the chair. So we basically schedule as my first column is what we call that me doing procedures. And then my second column is usually post-ops, follow-ups, ERs. ERs are usually my second column, because somebody calls in today, they want to come in. I leave enough spots in the schedule to make sure that we have time for at least 2 ERs per day that I'm here. That's just called schedule efficiency. Moving on to the next part. This patient had an ER, had a little part of the denture had a problem, comes in, we evaluated, we diagnosed, ordered the part, should come in a couple of weeks, move on. Next patient. This patient needs a crown insert. Again, the idea is that this patient does need anesthesia. So what I'm going to do is that I'm going to hop into this chair, anesthetize the patient. While the patient is getting numb for about 10 to 15 minutes, I'm going to go back and check on the ER patient, is that what exactly do they need? Because again, most ER patients, as you know, first 15 to 20 minutes goes into talking. You're really just talking to the patient, what's the problem, what's the diagnosis, how are you going to fix it. After 20 minutes, two things happen. Either you're doing the work or you're scheduling them, or option 3, you're referring them. But the 20 minutes is what I'm mentally thinking, is that where I need to be for those 20 minutes. So meaning that I would not want to go in and start the conversation with my ER patient while this patient is already waiting in the chair for 20 minutes. Then I start to numb the patient up. Then I'm again waiting another 20 minutes. Guess what? Now I'm 40 minutes behind schedule. So it's those little things that really matter. That's called schedule efficiency. So technically you don't need to work long days, long hours, or too many hours. The idea is that whatever you work with your schedule, if you make it efficient enough, it's going to work in your favor. Moving on to the next, implant check, implant impression, similar process. Now I'm having this patient come in, they're going to take a picture, assistant will get my scanner ready, I change the scan body, scan is done, 10-minute procedure. Moving on, ER patient right before Thanksgiving, head part of the bridge fell off. It's a little bit more involved of a process. Now let's actually look at this one. This patient comes in 12:20, bridge fell off. We use this terms called medium production, and honestly I don't really look at all of those things. All that means is that when our practice management software, we put some blocks around it, it automatically generates terms like this. So it's more of a software thing rather than me looking at any financial numbers. So I typically just ignore that, like whatever. What this means is that now this is a problem where the patient comes in and a bridge is broken. Hopefully I have privacy here. Yeah. So this was a 3-unit bridge, number 224. This bridge broke off and tooth number 2 is non-restorable. However, number 4 is still restorable. So out of the 3-unit bridge, the front abutment is still available to be fixed. So again, let's look at the timing. I know that I'm not going to start an extraction right now because I have back-to-back patients. However, this patient right before the holiday would at least want tooth number 4 because it's within the smile zone. What I simply did was that I sectioned the bridge off, took off number 2 and 3 out of the bridge, re-cemented number 4. Patient's very happy, call it a day. Took me about 30-40 minutes to do the whole thing. But that's where you're really planning. So when you have your 2 patients next to each other, I went in, my assistant took pictures, I diagnosed the problem, I told the patient how long it's going to take. Now I'm going to hop onto this chair, take the implant scan. Took me about 10 minutes to do that, but now all my 40 minutes of my time is available for this patient, which needs a sectioning of the bridge and re-cementing. But I know that I have 40 minutes because I finished up this procedure exactly on time and my assistant is starting to scan now. I don't need to be in there for that. So now with those 40 minutes, we sectioned the bridge, re-cemented, and I'm planning the patient to have come back in a week or two to have tooth number 2 extracted. I don't need to do that right now because A, the patient is not in pain, tooth is root canal treated, there is no sign of infection, and I would rather not do a slightly difficult extraction 2 days before Thanksgiving. That would be pretty difficult for the patient to go through. So again, having that exact conversation with the patient is that, look, I don't mind doing the extraction, but these are the pros and cons of doing the extraction right now. Would you want to do it right now? If you want to do it right now, I cannot do it right now. However, if you come back in about an hour or so, I'm going to have a little opening and we can do that if you're okay with that. Or we can do it in 2 weeks and this is the time that I can see you. Patient choose to come back in 2 weeks. That's what we are doing. Moving on, we are trying to have a little Thanksgiving lunch today. So I'm looking at my hygienist who has a little back-to-back patients. And then what I do is that we call the hygiene patient, last patient, offer them to come early because I'm pretty much running on time. And I had a 1:10 opening and I don't mind doing hygiene. So I'm asking the patient to come in early so that we all together as an office can have a little time to sit together rather than having back-to-back patients and then everybody's tired. So pick up things where you start to see things in your schedule. So that's the reason why I work very closely with the front desk and tell them, call this patient, call that patient, move this, move that. It just really makes things very efficient. That's my 2 cents for the day.